On behalf of the authors listed, I would like to thank the APACC 2021 conference organisers for the opportunity to present this analysis of depression, suicide and substance use among adults living with HIV in the Asia-Pacific region. I have no related conflicts of interest to disclose. Adults living with HIV have high rates of depression, substance use and other mental health related disorders that can negatively impact HIV clinical and treatment outcomes. Estimates of the prevalence of mental health disorders among adults living with HIV in the Asia-Pacific region vary substantially with study population, study design and screening methods used. We assess the prevalence of depression, suicidal ideation and substance use as part of a broader cross-sectional study. Adults living with HIV under care at 5 Treat Asia HIV observational database sites in Hong Kong, the Philippines, Malaysia, South Korea and Thailand were eligible for inclusion. Validated versions of PHQ-9 and Assist in local languages were used where available. If unavailable, translations and cultural adaptations were conducted as part of study preparations. HIV clinical and treatment data were accessed from participant medical records. PHQ-9 and Assist screenings were conducted by trained study staff or self-administered using tablets. Positive screening results triggered clinical follow-up according to local standards of care, and survey scores were summarised and reported descriptively. Of 864 study participants enrolled between July 2019 and June 2020, 88% were male, 53% acquired HIV through male-to-male sex, median age was 39 years, and median duration living with HIV was 7 years. At or around the time of study screenings, median viral load was 33 copies per milliliter, 92% had an undetectable viral load less than 1,000 copies per milliliter, and median CD4 count was 519 cells per microliter. 59% of study participants received a first-line NRTI and NNRTI regimen, with 49% receiving first-line efavirenz. 22% of study participants received a first-line integrase strand inhibitor regimen, with 12% receiving first-line dolutegravir and 5% first-line elvitegravir. On PHQ-9 screening, 353 or 41% of study participants had a PHQ-9 score of 5 to 14, indicating mild to moderate depression. 58 or 6% of participants had a PHQ-9 score greater than 15, indicating moderately severe or severe depression. PHQ-9 question 9, how often in the past 2 weeks have you been bothered by thoughts you would be better off dead or of hurting yourself in some way, was used to assess suicidality. 164 or 19% of study participants had a PHQ-9 question 9 score of greater than or equal to 1, indicating suicidal ideation on at least several days over the past 2 weeks. On Assist screening, 681 or 80% of study participants had ever used at least one substance. The left-hand light blue bars in this bar chart show that of those ever using at least one substance, 60% had used tobacco, 88% alcohol, 19% cannabis, 22% amphetamines, 15% sedatives, 6% hallucinogens, 5% inhalants, and 3% opioids. 553 or 64% of study participants used at least one substance in the past 3 months. The right-hand light orange bars in this bar chart show that of those using at least one substance in the past 3 months, 51% used tobacco, 80% alcohol, 7% cannabis, 12% amphetamines, 11% sedatives, 1% hallucinogens, 3% used inhalants, and 0% used opioids. Of those ever using at least one substance, 425 or 62% had moderate or high risk assist scores to any drug. From the middle and right hand bars in this bar chart, you can see that moderate or high risk assist scores were observed in 70% of those ever using tobacco, 37% of those ever using alcohol, 22% of ever cannabis users, 51% of ever amphetamine users, 54% of ever sedative users, 9% of ever hallucinogen users, 42% of those ever using inhalants, and 19% of those ever using opioids. The high prevalence of mild to severe depressive symptoms, suicidal ideation, and substance use among study participants highlights the need for improved integration of mental health and substance use screening and management. Enhanced linkages to specialist care for further assessment or interventions that cannot be delivered in HIV clinical settings are also required. Despite potential limitations, including sampling bias, we feel the study provides a useful and accurate picture of the current mental health and substance use burden among adults living with HIV in the region. Before finishing, we would like to acknowledge the study participants for their contribution to this research, the following investigators at participating study sites, and the US National Institute of Health who funded this study. Thank you.